UK is busy in general. We get the outlying, counties. We see their sick moms. They come here. We care for them for their high-risk pregnancies, deliveries, things like that. So we were busy. And then we had our nice, normal, healthy pregnancies on top of that. And since then, it's changed things.
Life has definitely changed. Even with the original COVID-19, we were seeing a lot of adults and very few children, but now with this Delta variant, we are seeing a high influx of kids that are normally healthy that are unfortunately getting hit really hard with this.
Not only seen an increase in the Delta variant, we've seen an increase in RSV. And I guess the theory is that so many kids were kept out of the malls, the parties. I always blame the mall Santa Claus lap that they set them on. But now we are definitely seeing an increase and they're more severe than we have seen before.
This wave's we've had quite a few more moms, and some moms come in asymptomatic, but we've had quite a few more sick, very sick moms in the ICU, and we've had deliveries early and then complications with deliveries and stuff related to how sick moms were from the COVID infection. So yeah, it's quite a bit different, I'd say, this time.
Yeah. I think the other day, half of my assignment, the patients were born to COVID positive mothers. And it was just kind of shocking how dramatically it's changed.
We're having higher acuity levels, which when you have higher acuity levels, you usually have more nurses. But with having short staff and higher acuity levels, you're basically giving it your all. You almost feel like you're running in circles, more or less, because it's just busy. It's very busy.
We are seeing a wide influx. We are seeing neonates down in the neonatal ICU that were just born, that unfortunately their mom was positive and then they ended up being positive. We're also seeing neonates upstairs in the pediatric ICU that are 1 month old. We're seeing that age range all the way to 19-year-olds or 18-year-olds that are previously healthy that unfortunately are sick with COVID, and then their interventions are ranging from just a little bit of oxygen to requiring intubation. We're seeing everything.
In a lot of situations, when the mothers have COVID, we can't allow them to come into the NICU where we have so many incredibly ill and very delicate infants who would easily, they would not survive contracting COVID. There are situations where we have infants who are here that we're taking care of them and their mothers are unable to visit on the scale of weeks. In other situations that are more severe, we have mothers who are so sick with COVID that, they're on a ventilator, a breathing tube, they're unconscious from sedation. We have to deliver their babies because they're so medically unwell, our OB team does. And then we're taking care of those babies where we'll have a baby here who we're taking care of for their prematurity, they're in severe condition, and then their mother's also in the ICU and has never even gotten to see her child.
We don't want to deliver earlier, but sometimes we have to because mom's not getting enough oxygen circulating and baby's not getting enough. It comes down to that oxygen exchange and the gas exchange that occurs through the placenta into the baby, and both are affected. So it's serious.
A lot of these moms, the sickest moms we are seeing, are young, healthy, otherwise, and they're pregnant, and then they contract COVID and are unvaccinated. And they are the sickest patients this hospital is seeing at times.
Not only are we having an influx with COVID positive patients, but we're also seeing a lot of respiratory patients with our normal respiratory season early. So not only are we having these COVID positive patients come in, but we're having kids that are sick with RSV and bronchiolitis on top of traumas. It's scary when you have a trauma come in when you're trying to figure out they're sick, but how sick are they really, because we need a room for this trauma. But on the positive side of that, I work with some amazing, selfless, the hardest working coworkers, and to be honest, I don't think that I would be standing here if it wasn't for them, because it is very scary, but when you have them bedside with you, you know that it's gonna be okay.
Our staff, they're also people, so, we have older, staff that work with us or people with other underlying conditions, other women who are pregnant themselves, who are taking care of babies. But when we have infants who are born to mothers with COVID, but the infant, requires NICU care, we're taking care of these babies, but we're going in all of our full PPE, trying to make sure, for our own health that we don't catch COVID.
Oh, it makes you feel guilty. My heart just breaks because there's times where I go home and I'm like, oh my gosh, I forgot to give something so simple as getting them a juice box or, a cracker. Sometimes I honestly feel like I failed them as a nurse because I want to do all the things and then more. Like I want to give them something before they even ask because I know how hard it is for parents to ask. It seems so silly, but at the same time, it's, I have felt like I failed them just because I didn't bring them something as simple as a drink that they asked for.
It's even that much more sad when bad things happen that could be prevented. The thing in the NICU is that most of the things we encounter can't be prevented, and we're pretty good at stepping into like just a natural situation, a preterm baby or something, and doing things to help. And when there's something that is completely preventable and something goes wrong, it's just that much harder.
We have seen very severe cases where babies are having to be born very early. Their mother's health is very poor because she's so ill with COVID. And, there are cases where the babies end up dying from being born so early in this situation. Often it's not, for these types of infants, the fact of them catching COVID themselves so much as, being in a situation where their mother's so sick that, the baby's health ends up being compromised in that way.
I don't think people really understand how easy it is to catch it.
So I think mental health is my biggest thing. For the nurses, for the techs, for the patients, for their families. That is my biggest concern about all of this. It's almost like pouring from an empty cup. When you keep giving it 100% and not feeling like you're being refilled.
I would really want people to know that it's real because I feel like a lot of people think it's not so real, or I got COVID and I'm not that sick, things like that. It doesn't pick and choose who's going to get really sick and who's not.
I would recommend that you get the vaccine. Seeing the situations that we have where babies are separated from their mothers die without ever holding their babies, it's just heartbreaking and something I would never wish on anyone. So I would recommend very strongly to get vaccinated and, help protect your family in that way. You'll be protecting yourself, by trying to prevent yourself from being ill, but also, being there for your baby. You will have a newborn baby who needs you. Being able to be present with your infant, not being sick, offering your baby everything you can. As women, we make a lot of sacrifices, and especially when you reach motherhood. You don't want to put yourself at unnecessary risk. The same way you would put your baby in a car seat when you take them home, that's not going to 100% protect everything. It'll give your baby a very strong advantage.